disability community. So David is one of Ontario's leading disability rights advocates. He's a lawyer with 2 degrees, one from the Osgoode Hall Law School and one from Harvard. He right now is the chair of the Accessibility for Ontarians with Disability Act Alliance, which is a non-partisan community coalition that seeks a barrier-free Ontario for people with any disability. He's also a visiting professor at Osgoode Hall Law School. He's a former general counsel, which is the highest position in Ontario's public service. And David, in his role as a professor, lectures on a variety of topics from constitutional administrative law to human rights and disability rights. His volunteer community advocacy work for the rights of people with disabilities has led him to receive the Order of Canada, the Order of Ontario, Ontario doctorates from Queen's and the University of Western Ontario, and far more awards than I can put into one introduction. And I think what there's so many things I admire about David's work, but one of them is just he is relentless, passionate, and clear in his communications. And I can't tell you how often I see him in variety of traditional media and social media platforms talking about disability rights. And so David, it's a real honor to welcome you and have you be part of tonight's live stream GPO conversation on COVID and how it's affecting the disability community. So thank you for joining me.
Well, thank you for including me and for including this topic. And, we're nonpartisan. When you invited me, I said, fantastic. And we're happy to do these for MPPs from any party, from any part of Ontario. In fact, I'd like to issue a challenge for them to invite us to talk about the same topic, because whoever the party is, the answers are the same and the needs are the same. So thank you so much for including this.
No, it's my pleasure, David. And many of you probably have read many of the articles about how COVID-19 has disproportionately affected the disability community in terms of both contracting COVID-19, but also how it's affected members of the disability community. Lots of conversation about access to healthcare services and testing, which I'm sure we'll get into tonight. I believe many people in the disability community feel they haven't been heard as much in this conversation. And I know I've had many people reach out to me who are on Ontario disability support payments who feel like they're falling through the cracks in many of the government support programs. And so it's really important to me, David, to ensure that the voices of people with disabilities are being considered as part of this COVID conversation, but also part of the conversation as we recover from the COVID crisis. So I'm just wondering if you want to begin tonight, David, with just an overview of the way in which COVID has uniquely affected members of the disability community.
Well, thank you so much. Let me begin by just drawing a sort of a comparison. We're in an emergency and we're doing one big emergency plan, and you got to cut any government some slack because lots of this wasn't foreseeable. But let's draw a comparison. Let's say you work in an office and it's on the 20th floor of a building. Everybody knows there could be a fire. So you always have to have an emergency fire plan. And imagine if the emergency fire plan was that, look, if there's a fire, we're going to have an announcement over a speaker. It'll say, time to leave the building. And there will be lights that'll illuminate the way to the staircase to take. And then you take the staircases out to get that staircase out to safely leave the building. Well, there's a fire, and all of a sudden they realize, wait, we got deaf people working here too. They didn't hear the announcement because it's only in spoken word. Mm-hmm. There's no illuminated signs. And we got some blind people here. They can't see the lights that are directing us to the staircase to leave. And then even if you get to the staircase, you suddenly realize some of the people who work here use wheelchairs. They can't go down these stairs. How are they going to get out of the building? That's what happens when you have an emergency plan that assumes that everybody has no disabilities. Well, in this world, lots of people have disabilities. 2.6 million Ontarians do. And you can't have an emergency plan that in effect assumes there are no people with disabilities and that we're just going to have one plan for everybody, because one size doesn't fit all. Unfortunately, that's what the Ontario government's done. So we've started out by calling on the government weeks ago when this was starting to ensure that they included in their emergency planning specific measures to meet the urgent needs of people with disabilities. Just like the blind person or the deaf person or the person in a wheelchair in that example I gave. Now, of course, there are many other disabilities. They're not the only one. I just use them to illustrate. So now, what's happening? Well, there's really 3 points, Mike, at a general level. The first is, as you mentioned, people with disabilities are disproportionately at risk of getting COVID and getting its worst effects. We've heard that seniors are particularly vulnerable. Disproportionately, seniors are people with disabilities, and people with disabilities are seniors. If you look at the numbers of who's died from this virus, disproportionately, it's people in long-term care. Well, those are people with disabilities. So, but also, even if you're not a senior, there are any number of people whose disability makes them medically fragile or have a suppressed immune system. So they're more exposed, and that's just a matter of biology or their medical condition. That's part one. Part two is the failure of the government to have an effective emergency plan that takes into account our needs, our urgent needs, makes people with disabilities, or some of them, even more exposed to get this virus. Let me just give you one example. There are people with certain disabilities who live at home independently, and the way that, and to help them do that, the government funds, commendably, an attendant care program where a personal support worker can come into your house and spend maybe an hour there or whatever time needed to help you get out of bed. If you can't do it yourself, get dressed and so on. Then you're on your way, and then they go off to the next individual's house. Well, the government did not plan in a way to ensure that they would have masks and other personal protective gear available to them. In fact, the government's policy was essentially, if you work in that field, go find that gear yourself. Well, good luck finding it in a crisis where there are shortages. What does that mean? That means that these folks, these attendant care workers, could well become, there was a serious risk that they would become carriers, spreaders from one person with a disability to another. And that is a risk, an increased risk to us by virtue of a government failure to plan properly. Then the third and final part of this, because you're disproportionately at risk of getting it, you're going to need the healthcare system. Well, we have a healthcare system that already had too many barriers that impede patients with disabilities, but that got worse during COVID. So you go into a healthcare system and you got a problem. And this reached its most horrific when our community learned through leaks in the first week of April that the government had a secret protocol for doctors on who would get a ventilator in the case of an overflow of patients and an inadequate supply of ventilators. Now, thank God we haven't hit that situation, but the government had a had a protocol written dated March 28th. They've since claimed when it was exposed that it was a draft, but the thing, no one's claimed it's marked draft. In fact, anybody's seen it said it isn't. And it, on an independent legal analysis by law professors, by the Arch Disability Law Center, includes clear discrimination against some patients because of their disability. So greater risk of getting this disease, greater risk of needing the healthcare system, barriers already in the healthcare system that are getting worse, and God forbid a situation where you might actually have a disability used against someone in refusing them life-saving care. Now the government said, "Oh, it's only a draft. It's not our position," but they haven't retracted it. They haven't rescinded it. They said they'd consult on it, but a month later, we're still waiting to be consulted, and it's still festering out there uncorrected in the healthcare system. So that's a long way of saying 3 ways in which people with disabilities are disproportionately being hurt by this crisis.
Yeah, David, I remember reading an op-ed you wrote in the Toronto Star, I believe, about April 20th, and you talked about the secret triage protocol, which shocked me at the time. But you ended that column asking the Premier to give you a call or to give any member of the disability rights community a call. Have you received that call yet?
No, we haven't. And unfortunately, and I've never met Premier Ford, but he's sort of made himself to be understood as the retail politician who, he'll call the person directly. Well, we're waiting for a call. But not only that, I wrote the Premier on behalf of our coalition back on March 25th and asked to be able to have contact and emphasize the need for an urgent plan to meet the needs of people with disabilities. He's not answered that letter. And I mean, he's a busy guy. His office hasn't answered that letter. No one from the Premier's office has called us at all or emailed us or reached out to have any discussions. We have had discussions with the Ministry of Accessibility and Raymond Cho's office, and we appreciate that, but they don't run any of the line operations that relate to this. We have had initiated discussions with senior officials at the Ministry of Education, and Stephen Lecce, the Minister of Education, today tweeted that he spoke with me today, which I really appreciated. We've presented the needs to them, and I'm happy to expand on what we've asked publicly them for, but they haven't yet delivered on the key things we've asked for.
So David, I want to talk about education in a second, but before we leave healthcare, the one thing I wanted to just emphasize, and you brought this up, that many of our elders have disabilities and are living in long-term care homes or nursing homes, but there's also thousands of Ontarians under the age of 65 with physical and developmental disabilities that also live in those types of long-term care nursing homes. And given the horrific report we read yesterday from the Canadian military, can you maybe just expand on the experience of people with disabilities in our long-term care and nursing homes?
Well, there's a combination of things. There's a number of congregated living environments. There's nursing homes and long-term care. There are people living in group home settings or assisted living settings.
Right.
And the issue that's been reported, obviously the media has been focusing on the nursing homes because that's where the biggest outbreaks are. And that's gotten the attention because of the fatalities and the rapid spread of the disease. But it's a serious issue, but it's important to realize that there are issues as well that are getting less media and political attention that relate to people with disabilities living at home. We got seniors living at home who might otherwise be totally appropriate candidates for long-term care, but whose families understandably would not want them moving in there because of its being so dangerous. And yet providing support to their family members and loved ones is harder during this lockdown. An issue in the community that I got a call about today that's a serious one is there are people who are caring for individuals with disabilities who have greater needs. There's any number of us who are quite independent, but there are those who are either kids or even adults who normally were out of the house during the day, either at school or at day programs or whatever. Now they're home full-time. Parents or family members are having to try to do their jobs and also take care of them full-time. And some of these folks are under incredible stress. And one community organization called me today because they actually want to offer a day respite program where kids with complex disabilities young kids could come there under appropriate safeguards. And the parents could get some respite because they need it, because it's a 24/7 job for them right now. And they can't get through to anybody at the government to even explore, like, what do we need to do? How can we do it? Or how can your reopening protocols be addressed for this? And so this is part of what's going on as well.
And David, I also heard lots of reports of members of the disability community having challenges being able to even be tested for COVID.
Well, one of the issues that was raised, we held when we saw that the government was not acting to plan for our needs, the AODA Alliance, which I chair, and the well-known and fantastic Ontario Autism Coalition, we teamed up to do a virtual town hall back on April 7th, where we brought together 10 experts to give the government frontline advice on what they should be doing in a number of these areas: healthcare, community living, education, and so on. Interesting, the government, by the way, with the exception of the context that I talked about earlier, has not reached out to us to learn from and build on what we offered there. It's available on YouTube. It's gotten over 2,000, I think almost 3,000 views. That's with us.
We'll share that link. I'll have my team share that link.
Absolutely. But one of the things that came up there was that there are people with disabilities who want home testing, can't get home testing, and they face barriers going to get tested. Now, Christine Elliott, the Minister of Health, at a press conference said there will be testing at home made available to them, but it hasn't happened as far as we've heard. And I certainly haven't seen it announced anywhere in case somebody wanted it. So that's just another example. If people watching us want to know more, by the way, if I can just do a plug, you can learn more about what we're up to on this by following us on Twitter. Our Twitter feed is at AODA Alliance, at AODA Alliance. And our website is www.aodaalliance.org, aodaalliance.org. And you can sign up there to get our email updates, because we're coming up with several a week to keep people posted. And the final thing is we've got a page just with our activities on COVID. Our webpage there is aodaalliance.org/COVID. So there's lots of ways to find out what we're up to. That's how we publicize these events we're engaging in, and encouraging people to not only watch our town halls and so on, but to encourage other people to do that too.
David, I'm just curious on access to healthcare. I mean, you've briefly touched on the triage protocol, but also I'm hearing reports of just challenges in accessing healthcare for people with disabilities, especially during the COVID crisis. Could you discuss that a bit?
Well, one example that on our website that the Toronto Sun covered, we didn't bring this particular case to them, though we did cover it in our town hall, is just as one example, there are a number of people whose disability affects their ability to communicate. They need assistance communicating. There are people with communication disabilities. And if someone in that situation goes to a hospital, they usually need either some technology or a person to assist them in being able to communicate. If you think about being in the hospital, you got to tell them what your symptoms are. If you want to ask for help, you're not feeling well, and so on. And yet, because of the lockdown due to the hospital situation, some of these folks can't get their support people into the hospital to help them. And hospitals generally don't have these kind of supports otherwise available. You got to bring your own. And a story in the Toronto Sun that was particularly disturbing was a family reporting that a particular Toronto hospital had a patient who has a condition like Lou Gehrig's disease, where the individual can't talk. He reportedly uses an iPad to communicate, but the hospital staff would only let him have the iPad 1 hour a day, reportedly because they were afraid he could be recording what the staff are doing, like doing surveillance or something. So literally 23 hours a day, according to this report, he can't communicate at all inside the hospital or with people outside. I mean, these are serious problems. And the Toronto Sun report said that the Ministry of Health said, well, these are decisions made by hospitals. Well, no, that's what we have a provincial government for, to set standards and make sure that these kind of barriers to fundamental rights, like the right to communicate, aren't violated. When you're alone in a hospital, your family members can't come to visit you, and when that iPad's not available, they can't even remotely visit you the way we're doing over this Zoom meeting.
And David, what are some steps the government can take right now to remove these kinds of barriers and this type of discrimination in accessing healthcare services?
Well, the first thing they should do is they got to commit to and immediately undertake an emergency disability plan. They need to identify what the urgent needs are, come up with some strategies. They can canvass the hospitals and other healthcare providers and patients with disabilities and find out what are the problems, what has worked. And like I have no reason to believe that every single hospital is refusing to let anyone have an iPad. They certainly don't, never, when I've been in a hospital myself, never took away my iPhone because I might be filming them. And then come up with an emergency plan and get, and you don't need a top to bottom plan, like get the advice out as quickly as you can. It could be a bit at a time. We asked for this back, in late March, and now it's late May. And a number of the really good ideas are available on our April 7th town hall. So on the communication disabilities example I gave you, a national leader, a national treasure on this is a woman named Barbara Collier, Collier. She's the director of Communications Disabilities Access Canada. She's an absolute gem of a resource. And she offered very practical tips on that webinar almost 2 months ago on what to do for people with communication disabilities in the hospital setting in a crisis like this. So the tips, a number of the tips are there. It's a matter of the government doing it. But if they keep going back to my high-rise fire example, assuming everybody can hear the announcements, see the lights on the floor, and walk down the stairs, we're going to keep having these problems.
Yeah. So David, if you don't mind me shifting gears a little bit, you talked in the overview of students, and I know emergency distance learning has been a challenge for all students, teachers, parents, everyone, but it's been a special challenge for students with special needs. And I know you've spoken out on this, and can you maybe describe some of the challenges students face and how we can overcome some of those barriers?
Okay, I'm happy to. And we've put these concerns in writing to the Minister of Education. They're up on our website at aodaalliance.org/COVID. So here's the problem. Understandably, the government was faced with a horrific crisis. They had to close the schools quickly. They had to scramble to figure out how we're going to educate our kids. And all families are under pressure. Parents are trying to both work and take care of their kids, and some parts of the province don't have proper bandwidth. We've got all those problems. Well, add to that the fact that our education system before COVID, like our healthcare system, has unfortunately been full of too many barriers impeding kids with disabilities, because it's actually designed on the implicit assumption that it's really for students with no disabilities. So kids with disabilities, what they sometimes call kids with special needs or whatever, are kind of an afterthought, where we have to grab the shoehorn to fit their foot into a shoe that's never been designed as if they might wear it. And when we moved to online learning, new barriers were created, or existing ones were amplified. And so the government, yet again, needed an emergency plan. They needed a plan to meet the needs of these students. We're talking about up to as many as 1 out of every 6 kids in our publicly funded K-12 schools. We're talking about 1/3 of a million or more students. But the government didn't create such a plan. In fact, if you look at their announcements, they basically say, here's what we're doing, here's what we're doing, here's what we're doing. Oh, and by the way, accommodate the needs of special needs kids. So they're leaving it to 70 or more school boards. They're leaving it to thousands of principals and teachers to go figure out themselves. You got a student who's deaf or blind or got an intellectual disability or got autism or ADHD or a learning disability. You figure out how to teach them, and go to a government website. There's a blizzard of links, and if you've got all the time in the world, go try clicking around, see what you find. That is a horrible way to deal with this. Now, recognizing the first week or two you can't solve all this because they were dealing with a huge crisis, but we're now 8 weeks into it or more. And this could be going on over the summer or past the summer, depending on the situation. Let me give you a couple examples. So the government has said that TV Ontario is its partner in delivering online education. They've got all sorts of resources, and their Learn at Home website has all sorts of links to TVO. So we went to take a look at TVO's online content, And just so your viewers know, I'm blind. There are a number of people with different disabilities, with learning disabilities, some of them with vision loss, with a number of disabilities who need to use adaptive technology to use a computer. We can do it, but we need to make sure that the website or the documents are formatted properly so we can use them too. Accessible design. That's not new. That's been an issue for as long as there's been an internet. And we have laws and protocols in place. TVO's web content in a number of places has serious accessibility problems. So does the government's Learn at Home resources. So their online partner resources have not, the government itself and its own government-owned TV network, educational TV, has not ensured the accessibility of its own content. Now, this stuff wasn't created for COVID. It pre-existed,
Right.
or was assembled and amplified for COVID, but it's a huge problem. Let me give you another example. If you're going to move to online learning, and if you're going to have an online class, like the first thing you need to do is make sure that the computer platform you're using, we're using Zoom here for you and I to meet, and then we're streaming it out on various social media. But you got to make sure that that application is accessible. Some applications are more accessible, some are less, some are not at all. And that's important for students with disabilities, for teachers with disabilities, and for parents with disabilities. This is not news. But the government of Ontario did not ensure that school boards are using accessible platforms. They didn't even tell them to. They haven't even set that as a sort of a direction when they lay out the groundwork for what they are going to do during this. The government has explicitly told us, in a meeting I had with public servants, that they're leaving it to each school board to decide which platform best meets the needs of their individual students. Well, guess what? A kid who's blind in Kenora is just as blind as a kid who's blind in Cornwall, or dare I say it, in Guelph, where you are, or in Toronto, where I am. Our accessibility needs don't vary. Why on earth is the government of Ontario leaving it to each school board to either not do anything about this, or to have each teacher, principal, or school board decide on their own whether they're going to look at accessibility, and if they are, what choices they're going to make? That's just to get into the class. That's before we get anywhere further. Now, it's not good enough to complain. We said the government needs a plan, and we gave them a really good idea, an idea which they have not taken up. If your jaw hasn't dropped, I predict it's about to.
Okay.
Okay. So what we said over a month ago is, look, teachers and parents on the front lines here in Ontario and elsewhere are doing really creative stuff. Teachers of kids with disabilities, parents of kids with disabilities, to invent ways to get around these problems. What we should do, what the government should do, the government of Ontario, is reach out to the front lines, the parents and the teachers on the front lines, gather up their really good ideas and make them available to the other teachers and parents. Not a web page with 8 billion links, but maybe like short lists of here's a bunch of strategies that work, and so on. Government hasn't done it. So what we did, remember I mentioned a town hall we did in April?
Right.
Well, we did another one in May 4th. I'll send the link to you to post on it.
We'll send that link out to you.
That one's already had almost 1,500 views. And on it, we got 5 or so speakers. This is, again, the AODA Alliance and the Ontario Autism Coalition. And we got people together to just give practical tips for frontline parents and teachers on educating kids with disabilities at home during COVID. We had an expert on deafness. We had an expert on blindness. We had an expert on autism. We had an expert on behavior issues. We had a spectrum of things. And we had an assistant deputy minister from the Ministry of Education. And he said that these were really useful resources. Well, we've been asking the government to take over this idea. Here it is. We did this with volunteers. Why don't you do it? You're the Ministry of Education. That was May 4th. They still haven't done it. Now, this is where the absurd becomes the most absurd. We've also said to the government, we've created this one town hall. You say you want to share resources around the school boards. Why don't you send them the link to our May 4th education town hall? Well, we've raised this with public servants high and low, and so far they haven't done it. Now, how much does that cost to just send them an email saying, hey, folks, here's a resource you may find useful? When we've talked to teachers, when we've talked to school board officials, they say, we need this stuff.
You actually hit the point that where my jaw was dropping is you're delivering solutions at no cost, and government isn't even taking the no cost solution. I find that very frustrating.
Well, this experience is akin to swimming up Niagara Falls, but when you do disability rights advocacy, unfortunately, we're used to it.
Yeah, unfortunately. I know we're going to run over time a little bit. I usually been doing these half an hour, but I still have a few more questions. So
I'm happy to stay.
You happy to? Okay, good, David. So you mentioned accessible design, and integrating accessible design into everything we do, I think is critically important. And one of the things you've spoken out on recently is the Curb TO plan. And I'm particularly interested in this plan as we look at how do we open our economy and our communities as we emerge from COVID. But if we don't integrate accessible design into that opening, then we're going to create a whole bunch of other barriers. So I'm just wondering if you have some ideas, suggestions for municipal and provincial governments to help
Sure
us
do.
get through
We
these.
sure do. Here's the deal. Many of our viewers will be perhaps shocked to know that our building code, which sets accessibility requirements, is grossly inadequate and out of date. So that if you build a building that is 100% compliance with the code, it'll still risk and likely will have accessibility barriers. And we tried to get the government to change this over and over. Last summer.
Right.
The NDP proposed a motion calling for this, and the government voted it down.
I voted for it, just so you know, David.
I'm with you. We really appreciate it. And the government condemned it as red tape. Now, let me talk to you about this red tape. I want our viewers to think about something. When we come out of this lockdown, and when we're still having to do social distancing and washing our hands and stuff, and you're in public and you go to a public washroom, I bet you'd rather go to a washroom where the toilet flushes automatically, where you don't have to touch the lever, where the water tap runs by putting your hands under it. You don't have to touch the tap, where you get soap out of the dispenser automatically without touching it, and the same for the towel, because that'll help you stay safe. Well, you've seen those in some public washrooms before, but you know what? My understanding is it's not required by law.
Right.
And our efforts to try to get the law improved, we get told it's red tape, it'll cost too much, and so on. Well, I bet all of you wished you could go back in time and tell those governments, folks, you're endangering us. This not only serves the important goal of, disability, accessibility, inclusion, but it also is going to protect public health. So what we need to take away from this now is, as this eventually comes to an end and we can recover from all of this, the old approach that the governments have taken, and not just the current one, but the previous one as well, to the accessibility of the built environment and some of these other problems, that's got to end, because it's hurting all of us now in ways they didn't even imagine.
Yeah. And David, do you mind if I just take a few minutes to
Sure.
talk a bit beyond COVID for a second?
Sure.
Because I know an issue that, the Alliance is named after the AODA Act. And our former Lieutenant Governor David Onley wrote a review of our progress meeting our AODA goals that came out last March. And I believe, I don't know if the government, I think the government said they were going to accept one of the recommendations, but I don't know if they've actually accepted any of the other recommendations. And I know it's something you are very prolific about on Twitter, is challenging all of us, so not just the government, but everybody at Queen's Park, on acting on the recommendations so we meet our AODA obligations.
So let me thank you so much for raising this. I'm delighted to. So the Accessibility for Ontarians with Disabilities Act is a law that was passed by all parties in 2005, unanimously. And I had the privilege for a decade before that to lead the campaign and the coalition that campaigned to win the enactment of that law. It was a long, hard battle. It requires the Ontario government to lead this province to become fully accessible to all people with any kind of disabilities, physical, mental, sensory, communication disabilities, learning disabilities, all of them, by 2025. And part of that report, that law, one of the features is it required the government every few years to appoint an independent review to study how we're doing and make recommendations. So 2 years ago, the government appointed our former lieutenant governor, himself an individual with a disability, David Onley, to consult the community, find out how we're doing, and render a report. He did that. He rendered a report a year ago, January. I've been running a count on Twitter how many days it's been. The government has still not announced a plan to fully implement that report. And one of the recommendations, probably the lead recommendation, is he said his finding was that progress on accessibility is way too slow. He referred to it as being as glacial. That's not just this government, but the previous government as well, progress on accessibility. And he said that we have a province full of soul-crushing barriers facing people with disabilities. This is all before COVID. And one of his key recommendations is the government needs a plan to get us to the goal of accessibility. Now, does that sound a little familiar? Mm-hmm. We didn't have that plan before COVID. Along comes COVID. The one thing people with disabilities need more than ever is a plan to address their urgent needs during COVID, whether in healthcare, education, or otherwise. We don't have that plan. It's the same blunder carrying on, and that is deeply troubling. Now, if people want to know, if you're watching this, is okay, it's good enough to complain. What do you do about it? I'm going to ask people to go to aodaalliance.org, sign up for our updates, follow at AODA Alliance on Twitter. We give you practical tips on how to advocate. We're encouraging you to send our education town hall to teachers you know. If the government won't do it, could you do it? We're encouraging you to write your member of parliament, of the legislature, or email them and tell them, where's your action plan on disability during COVID? We give you the action tips, we give you the links, we make it easy, and we welcome your help, and we really appreciate this platform to share those ideas.
Yeah, no, David, I will definitely send those links out. I just really admire the way in which the AODA Alliance, just the advocacy work that you do, and how practical and pragmatic it is in providing members of provincial parliament with guidance and direction, but also with the public direction about how they can advocate.
Well, you know, I could give the government a huge long list of things. You got to do all these 8 million things. They're going to say, fine, we're in a crisis. So we give them short lists of crisis-focused activities. And that's important. By the way, the other thing I should tell you, you'd asked me about the government implementing the Onley report. The Onley report said the government needs to take an all-of-government approach. Like, don't just isolate accessibility in one corner. And said the government needs to lead by example, because they've not been a good example on accessibility. So what did the Ford government do? And again, we're nonpartisan. I'm just telling you what it is they did. If they did good things, we congratulate them. And if they do things that aren't good, we have other things to say. Same with the previous Liberal government. But back on, I believe, the 28th of February, the minister responsible for accessibility, Raymond Cho, held a big media event that they carefully staged and organized. And their big statement in response to the Onley report is, we are going to lead by example on accessibility. And we're going to take an all-of-government approach on accessibility, making it sound like they're adopting what David Onley recommended. Well, look at what's going on by COVID. When it comes to healthcare, and there's no all-of-government approach, and they're not leading by an example. When it comes to education during COVID, they're sure not doing that. The government's own TV station or network, TVO, serious accessibility barriers in their content, that's not leading by example. It's sure not an all-of-government approach at all. So they said the right thing. It's just they're not doing it.
Yeah, just to prove the nonpartisan nature of your comments, I remember viewing a video you had put together of transit stations that were being built by the previous government, but not that long ago. So well after the passage of the AODA Act, that we were building new infrastructure that wasn't accessible. And for me, just from a cost perspective, even it's so much less expensive to incorporate accessibility design into it in the first place than have to like renovate and retrofit later to make it accessible. And I thought it was one of the most powerful videos that you'd put together.
Well,
That I'd
thank you very
watched.
much. If you think about it, it's a recurring theme for us. Back to education. If teachers around this province and parents are coming up with creative ways to teach kids with disabilities despite the distance learning, it's cheaper to spend a bit of money up front, gather that information. It's a bit of staff time, gather the information and package it up and send it out. It's not that hard. 3 or 4 or 5 of us as volunteers working part-time put a town hall together in 5 days, and you pop it up on Zoom, stream it through YouTube, and off you go. We're not talking about tens of thousands, or even hundreds of dollars. It's easy to do if you just decide you want to do it. There's lots of examples of real progress, and there are times you do have to spend money on accessibility, but there's lots that could be done that will save money.
Absolutely. And so, David, I want to just draw our conversation to a close by thanking you once again for taking the time. I know you're an incredibly busy person with many demands on your plate. So for you to take the time and speak to our audience live, and of course, we'll make all the links available on social media so people can watch it moving forward. Are there any other parting thoughts that you want to leave our viewers with before we close out?
There's just 2 quick thoughts. The first is a huge thank you for both doing this and putting the important and tough questions and giving a platform for this to be discussed. But the second is I just want our listeners to know who we're talking about. We are talking about 1/3 or more kids in our schools, even more if we extend our discussion to post-secondary students. We are talking about 2.6 million people around the province right now, but more people, everybody eventually everybody either has a disability now or someone near and dear to them with a disability, parent, a child, a spouse, sibling, or you're going to get a disability later in life because we all get older, I hope, and age is the most common cause of disability. So what I'm talking about now is a problem that touches everybody's life. Premier Ford commendably said that he wants to protect the most vulnerable during this COVID crisis. I praise those words. I just ask him to do it, because who's going to be more vulnerable than people with disabilities? I say to the Minister of Health, people with disabilities in your healthcare system right now, who could be more vulnerable? I say to the Minister of Education, during these school closings and then when we go back to school, who's going to be more precarious and vulnerable than students with disabilities in dealing with this and their families? So yes, it's great that the Premier said he's going to protect the most vulnerable. Here they are. Where's your plan? Please call us because we're eager to help.
Well, David, I hope the Premier takes up your call to be called from your column on April 20th in the Toronto Star, and for your call to be called tonight. And I'll sure to be, when I'm back at Queen's Park and I see the Premier, I'm going to ask him to call you. Thanks for joining us, and thanks everyone for joining us tonight for this really important conversation.
And stay safe.
Stay safe, absolutely.
Thanks very much.
Bye now. Thank you, David.